Namaskara, Elogu. Very good morning. HealthTech 2030. Let me start this discussion with one interesting number. 39 million, which is about 390 lakhs, 3.9 CR. It's not the value of real estate in Bangalore. Can you guess what it is? It's 3.9 lakhs of people in India who are pushed into poverty, not because of unemployment and not because of lack of jobs, lack of loans. It is because of lack of access to quality healthcare. That's true. It's close to 4 CR, Nala Koti. Just imagine every year, while we have a vision of Vikasit Bharat to become a prosperous nation and developed nation by 2047, every year about 4 CR population is getting pushed to poverty because they're not able to spend their savings and have an access to good quality healthcare. And there is always a fight between survival or access to a good healthcare. And they are losing their hard-earned assets, money to get good medication and treatment. So now the opportunity we have is, one is, how can we make healthcare affordable on one side? And in the age of AI, how can we really make AI accessible, healthcare accessible through AI is one, and how can we also uplift these people, not in tier 1 cities, but tier 2 and 3 cities, which is about 800 million population that have to benefit in terms of affordable healthcare. So it's AI-powered healthcare is on one side, on one hand, and other is how can we make this affordable healthcare for this Indian population. So this is a fantastic panel. I would like to introduce very distinguished panelist to start with Dr. SUMANA. SUMANA is a Global Employee Wellness Officer and Global Account Director in SMX Services Consulting. And she actually works at the intersection of hyperscalers like AWS, Azure, and enterprise health systems across US, LATAM, and Spain. And she brings in global systems delivery lens into the healthcare delivery. Mr. Rajesh Dembla, who is the founder and CEO of Zuzul, he's a pioneer in e-commerce platforms, bringing consumer platforms into the reach of every Indian citizen. He brings a perspective of platform building consumer trust and distribution at scale. And he's actually central to how health products and services can reach people across India. So let's listen to his vision around this. Eswar Prasad is a co-founder of Arohan, Hasprana Healthcare Solutions, and he's also a professor of Dayanand Sagar University. He brings a wealth of experience in consulting, AI program management, and also he's a PhD scholar in entrepreneurship. So let's hear to his vision from an entrepreneurship standpoint on this topic. And Pardha Saradhi, cockroachpreneur, it's a great privilege to have him here also. He's a founder of Mom Pharmacy, which is redefining the last mile medicine delivery. And he's building a full stack, owning the inventory, technology, and has a grand vision to make the healthcare accessible in tier 2, tier 3 cities. And over the next 30 minutes, let's dive into how each one of them and their perspectives can ignite thoughts in all of us in terms of making AI-powered healthcare and also affordable healthcare. And that's a theme of HealthTech 2030. So I welcome all of the distinguished panels and myself. I'm Vinay Simha. I'm the founder of Strategic Business Networks. I'd request all of you to give a big round of applause to our distinguished panelists. And let's get started. And ladies first, Dr. SUMANA. We all know the hunger for AI in Indian healthcare is real, and we hear it every day, and it's growing fast. But if you really look at the numbers, the data says that the affordability gap is equally real, right? So you're now deploying healthcare through the wellness technology and through the partnership with hyperscalers, AWS, Azure, and so on. So a couple of questions. One is, where in the technology stack does AI close that affordability gap? So how can we really close that affordability gap is one. And if there is a real cost of delivering the healthcare, and there is always a focus on that cost residing on the platform, but how can we move that affordability and saving cost to actual patient in terms of outcome?
Thank you so much, Mr. Vinay. Namaskara, Bengaluru. And firstly, I would like to thank EVENTEX EXPO for giving me this opportunity. And I'm representing my organization, SMX Services and Consulting, INC, USA. So I'm here only to attend this event and talk about, since I'm from, am I audible? Yeah, since I'm from medical background, I'm a doctor, but I'm into IT for past 20 years. So AI is like a new toy to everybody. Everybody wants AI. Now, few people are scared AI is going to take their jobs. Few people say people are misusing it. But I feel AI is the strongest weapon when it is used for the right cause. And when I say the right cause, of course, health comes first. So the AI affordability cost gap, that lies in 3 layers. First, it is the front line. So basically, the front line, as we have seen during the COVID times. So AI, if implemented there, it reduces a lot of time. Like, there are so many AI that gives your blood pressure and your heart rate in seconds. So that helps in saving the diagnosis time. And then comes your clinical. So in the clinic, it also reduces doctor's time to diagnose what exactly the cause is. It can be a chronic disease or an acute disease that can be detected in a very small time. And then comes your operational level. So when I say operational level, your claims, your insurance, and all that. Now, how can we close this gap? Now, AI alone cannot do everything. So when we say, okay, we have AI, matlab it will do everything. No, it is not like that. AI has to be made affordable with a collaboration of government, public, and private sectors. So when I say this, it is like, public as in, how do we make it affordable to the public? Like, well, in urban areas, there are no problems. But when it comes to rural areas, there are people who do not know even how to use a smartphone. So first, educating that group of people is very important. And apart from that, rest is like reducing the cost of the platforms. And the government should bring in the Ayushman scheme that has to bring in some more affordability to the people so that that can be used in a very good way.
Thank you. So one is the cost and other is how do we make it accessible. So cost is one aspect, and that's a great segue, Rajesh, from your perspective as an entrepreneur and also an investor and also a pioneer in the e-commerce. You have actually deployed e-commerce platforms and made it accessible to a lot of consumers. Right now, in the context of applying AI to the healthcare, how do you want to bring these practice of the best practices from the e-commerce of making this accessible through building platforms and envision building AI tech platforms that can reach patients? Along the way, what are those practices which you don't want to also bring into these new business models of making this accessible through health tech platforms? If you can share some thoughts.
Thanks, Vinay. Thank you. This is a very interesting question. It's multi-pronged. So let me just answer one by one. What are the practices from general e-commerce, product e-commerce that I wouldn't want to see in the health tech e-commerce would be suggestions. People who bought this also bought that. I wouldn't want to see that because then it's very oxymoronic. It's not supposed to be part of the, what else would I not like to see? Any impulse-driven buying. E-commerce is, heavily focused using AI to push impulse-driven buying. I wouldn't want that in health tech. So these are two things that I can mention off the top of my head. What would I like to see? Would be any predictive, demand. Inventory usage at the hospitals, inventory usage at e-commerce companies, basically, those kind of, any kind of predictive analytics that can be given, that's good, irrespective of whether it's for product e-commerce or whether it's for health tech. Supply chain management, okay, definitely needs AI, irrespective of what you are doing. How do we make things affordable, right? Now, I can take one example. Say, for example, let's talk about breast cancer. Most people want to screen. Most women want to screen all the time, and they should, rightfully. I'm just taking one example of breast cancer, right? Could be any other cancers. If detected early, can be treated, and people become 100% normal, and that's what we should be doing today. What about a home device? A simple home device which could cost less than $10. With a small subscription of, let's say, 100 rupees a month. What if every woman in India can have it at home? Instead of going to a hospital, instead of, in some areas, in most of Bharat, when we talk about, they don't even have access to such hospitals that do mammography or any other kind of a test. So, in my opinion, there are many startup founders here. There are many people who are looking to build something. If you can build, when we talk about AI today, everybody is talking about, I build an AI startup. So I'm just going to quickly end by saying this. Building a wrapper on top of something and making it look like AI is not going to make you last. You're just going to fizzle out very, very soon. I mean, if you last 6 months, it's a miracle. If you can build using Anthropic or OpenAI or Gemini, it doesn't matter, okay? But if you can build something that has a layer on top of it which cannot be replicated by everybody else, that's the kind of startup that, as an investor, I would look at investing. And I'm sure every VC is looking at it, right? Can you build devices that can be affordable, that can be available, where distribution becomes easy? Can you partner with large health, brands? Instead of trying to push it off as your brand, can you partner with the Apollos and the Manipals of the world? It's okay. Partnerships are the only way you will really make big sense. So yeah, those are the kind of initiatives that I would like to see from the industry. I hope I've answered your question.
Absolutely, very clear. It's such a profound thoughts. I'm sure it's going to ignite thoughts in most of the entrepreneurs on what could the future of health tech platforms they should look at. While we are talking about the cost and access, there is someone who is actually making it a reality. So there is a gap that we discussed between the financial devastation of falling sick or falling ill, where people are losing their assets, and the absence of access to affordable health care. And that's a problem precisely that Pardha Saradhi is trying to solve through mom pharmacy. And he owns a full stack in terms of inventory, technology, last mile delivery using drones. Okay, that's going to be the future. And that's also what excited me. And he's doing this, and his vision is to do this entire 3 cities. Just imagine rural India getting access to quality medicines through drones. And he has already started this journey, not as a vision, but practically deploying it. So the question to Partha is, thinking about last minute health delivery that is direct and financial, where exactly AI can enter that operation is one, and what specific cost it can remove. So from your practical experience, and whatever cost that you remove, can we pass on that as a saving to the patient, especially in the rural areas? And who is paying for this cost entirely? Is it going to be the investors, or it's going to be the patient, consumers, or it's going to be the your startup? So how exactly the cost equation works? And your lessons from entrepreneurship can help benefit a lot of them.
Definitely. Thanks for wonderful opportunity. So first, coming to your question, like how AI can help to get that accessible and affordable. So AI can predict the demand, where exactly demand is going to be. Let's imagine, like taking as example of Nellore in Andhra Pradesh. The population in Nellore is like 5 lakh people. So what is the disease that people get common? So AI can have a past data and analyze it, see where the demand is going to be. So based on that, we can prepare our inventory planning, and the last mile cost is very less, and the wastage of the returnable medicine is very less in AI part. And coming to your specific cost, the cost is drone. When it coming to drones, the cost of manufacturing is very high in India, because the regulations and the policies are not yet made completely for drones. So the point is, you need to have a proper regulations, proper policies to make it affordable and accessible for every enabler who take that product to end customer. So the cost is not from the company or not from the customer. The cost is coming from only from the manufacturer. And if you take the average cost of drone delivery, it happens in India, is like 200 to 300 rupees nowadays. But if we take mass production of drones, then the cost may go to from 40 to 60 rupees. Because the cost of manufacturing the drones is very high. Because we are importing everything from out of India. We don't have any OEMs. We are getting everything from out of India. So that is one of the major challenge Indian ecosystem is facing in drone industry. And when coming to the last question, who pays? Absolutely, consumer is the investor to the company. So no matter, maybe company says that we have got raised funds of 100 million, 200 million or 300 million. At the end, consumer is going to be pay the entire amount to the company. So ultimate answer for that last question is consumer. Yeah, thank you.
Excellent. So if you're a policy maker here, please note this. We need an immediate attention on how to really revisit the policies and frameworks needed to make healthcare accessible, leveraging technology, in this case, drone. And segue to the next question is about how to make AI work. We have Eswar Prasad, who has a first-hand experience of deploying the AI diagnostics and also AI-based solutions on the cardiac care. And now the question to you, Eswar, is the evidence for AI in healthcare is no longer theoretical. We know AI works, and AI can also reduce the cost, as we have heard. But in reality, the data says that it's only 12% of AI applications are actually hitting the production. They're all stuck in the proof of concept. So now you're actually building Arohan as an enterprise from scratch, and you're deploying AI-based solutions reaching the patients. So the question to you is, from your experience, at what specific point in the care pathway, in the healthcare continuum, does AI produce a measurable value in terms of cost reduction or in terms of diagnosis at a quicker time point? And where exactly your business model that AI fits in is one. And where does it take beyond the algorithm to realize the saving at the real scale that we are looking at? So if you can share how you have put or how you have applied AI in the context of building Arohan, you can also share your story about Arohan and then help us learn from your experience.
Thanks, Vinay. Yeah, thanks everyone. Hello. I think from the cost perspective, I believe Dr. Sumana already addressed. And also from the past question, consumer is the one who is paying, right? And your question is more from a patient perspective, which is the consumer and healthcare. Apply, right? So I would say you will have to focus on shifting to the left, then optimizing the right. Meaning cost savings can happen, of course, during treatment, but then more on the diagnostic side. For example, prevention. So in Arohan, we started off with what you call detection. I mean, after the fall, we usually prevent cardiac issues. But then we pivoted to prevention dimension. Because the more left you go, the better savings you will incur. The downstream costs will go down. For that matter, any sector, it's not just healthcare, right? So on the second question, that was a very interesting question on basically beyond the algorithm, right? So what we feel is trust is a very important factor in healthcare industry. So, for example, in Arohan, see many companies say that we diagnose diseases even before the symptoms come. It's a very, very challenging situation to be in. It's not a feature, but a liability, I should say. Because even in Arohan, whatever algorithm we have, and if the prevention, at least one wrong diagnosis, it will cost a lot. Our entire, the reputation will go for a toss. And it's very difficult to retain this trust back. So beyond, although your AI algorithms are really very accurate, see, AI has been democratized. You see LLMs being offered for free for 1 year from many telecom companies, right? So it's not about increasing the accuracy of AI, but he was talking about the adoption. So trust is something that is very important. Now, in Arohan, we say, don't look at AI as artificial intelligence, but ambient intelligence. Meaning, it should become invisible. AI should become invisible. Because I think Dr. Sumana was mentioning about the acceptance and awareness, right? From both patient perspective as well as doctor perspective. We learned this hard way in Arohan. There was no acceptance, even, in my personal case. So when my wife was pregnant for the second child, we went to the gynecologist and she started Googling and explaining what it is. And there was no acceptance from our side. I looked at my wife and said, this Googling I also can do. But what Googling, what prompts she gave is something that I and my wife cannot give, right? So this is a classic example where there is no acceptance from patient side. Now, instead of building awareness, campaigns, all of that to build awareness, acceptance, it's better you make AI invisible. When I say AI invisible, you have to make it disappear in the workflow of doctor-patient flow, right? Doctor should not know that you are using AI. Patient also should not know that you are using AI. It's just deep tech, some technology tool that we are using to solve. So there is a very good startup which we are closely working with, and it happens to be my brother's startup, which is Medev Plus. It's they have commercialized a product which is the world's first mobile device for eye diagnostics. And what they do, they basically, for any eye disease diagnosis, patient has to go to the hospital. Yes, but they have a mobile device. So this device goes to the patient. So seamless it is. And similarly, the device with the click of a button, it generates a report, the scan report. And that's how seamless from the doctor's perspective. So when you build these kind of devices, that is when adoption will improve. Right? Otherwise, adoption cannot improve, right?
Absolutely. So that triggers a thought in me. Also, the next round is where we can also go a bit fast track considering the time. So I'll give you a minute to quickly share your insights. The use case that you shared is fantastic. But the challenge we have, Dr. Sumana, I would like to hear your thoughts, is about 450 million of Indian population, maybe more than that, today still remains to be uninsured. But access to healthcare, quality healthcare, Fortis, Apollo, whosoever, can happen only if to the insured population, which happens through corporate. And you have been building the wellness platform for India. Now, if you have to take the paradigm that Eswar mentioned to the population scale, how can we do that? So if you can share your thoughts.
Okay. So, well, as you said, I feel, all the big hospital is privileged for the people who have money, which I have seen in my experience. And the COVID was the real eye-opener, how the patients were treated, if they are coming from a reference or with big money and insurance, then they were given the 5-star treatment. Otherwise, they were considered as BPO, below poverty line. Well, my suggestion is as I said in the beginning also, health is the most important thing for each one of us. So in this world today, in all the rush and gush, we forget that we are human beings and we have to take care of ourselves. So in a way, for me, AI is a blessing. Now why? Because as I said in my first answer, it saves a lot of time, early intervention. It reduces the doctor's time, wherein, the doctors have multiple tests, the blood test, everything is done in seconds. So, coming back to your question, how can people who do not have insurance can, get these services of big hospitals? Well, again, I reiterate, it should be a collaboration effort by insurers, by our government of India, and by the people. Now, how can the insurance companies do? They can come up with micro-insurance policies, wherein, you have the ration card and the BPO card, this kind of micro-insurance has to be given to the people underprivileged or who cannot reach out to big hospitals with good facilities. Apart from that, it's also, as I said in the beginning, I think 40-45% of the people do not know how to use a smartphone, or they do not even know what is a health card, right? So I believe, health card is something that has to be given like an Aadhaar card to every individual in the country. Because with that health card, like the way it happens in US, since I've been in US for these years, so I've seen that health card is connected to your SSN number, wherein, you have the federal law, wherein it is connected to the insurance. So all of them work together so that, the treatment can be given to the best. See, as a doctor, though I'm not practicing, As a doctor, my advice to everybody who's in this wonderful profession, our intention should not be to take care of the patient, but our intention should be to treat the patient and make the patient get well.
Thank you, Sumana. So I have one common question to all three of you, and 30 seconds. It's going to be rapid pace, not fast pace. So if you could change one thing, maybe a policy, behavior, infrastructure, or it could be a decision that would have a highest impact on making AI-powered healthcare genuinely affordable for Indian population by 2030, what do you think that could be? I'll start with Rajesh and then we will segue. 30 seconds, quick.
I'll try to keep it under 30, okay? So I think we are trying to solve too many problems, okay? It's not possible to solve all the problems at one time, so let's solve from the grassroots, like basic, right? So let's look at, can we provide AI-powered devices across India, something like, something similar to SkyDoc, okay, which can be probably 60,000 to about 100,000 villages at one time can be covered, where villagers can have access to a device, and those devices are intelligent enough yet connected with hospitals, where they are given basic treatment first of all. Let's not talk about surgeries. Let's give them basic information. They don't even know how to go about doing that, right? I think that is the first thing the government should push. There are enough startups in India who have built such products, and they're not expensive, right? They're not at all expensive. It could be under 3,000 rupees a month of operating cost, right? And for a whole village, it's really nothing. So I would want to see a change, like that. There are a whole lot of other things that I can talk about, but we are running out of time. Maybe for another day we will save it.
Absolutely. Thank you, Rajesh.
So I could do two things. One is infrastructure. As a technology, like the penetration of technology across cities, Tier 1, Tier 2, Tier 3, to get that access to online doctors, and getting into the policies, making right policies which can impact billions of people. So these two things can change the accessibility easier to the end customer.
Thank you,
Yeah,
Pardha.
thank
Eswar?
Yeah, so the way incentives are given in the entire value chain, all stakeholders, that should change. Meaning, right now, the way we do is pay by service, but if we do pay for outcomes, and outcomes again should be, the goal should be for everyone, the provider, patient, everyone. So this model should change.
Excellent. Thank you, Eswar. So there is a whole lot of things that have to be put together to make healthcare accessible, and there is clearly an opportunity leveraging AI to make health tech more accessible, affordable across Indian population. So this discussion was mostly to ignite the thoughts in the entrepreneurship community here, and also investors to bet on what are the opportunities to solve this problem and at scale. So I would like to thank the entire panelists for sharing their views, and I hope it resonated with all of you. And they'll be available in the networking area if you have any questions to continue this conversation. So thanks a lot for being patient and listening to this conversation. Thank you.
Well, that was a great discussion. Healthcare is something that not only India, but also worldwide, it's very important that people get not only accessible, but healthy and hygienic healthcare.